Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby, and I'm here today with Dr. Florence Baralatei, and she is board certified in not only family medicine, but also in gerontology and in hospice and palliative care medicine. Today we're going to talk about her memory care clinic here in Central Georgia. Dr. Baralatei, thank you so much for being with us.
It's my pleasure.
Would you first let the audience know a little bit about your specialty, and would you describe geriatric medicine as a specialty for the viewers?
Yes, geriatric medicine is a specialty that deals with I call it the general health of those older than 65 and older. We serve like their primary care physician looking at the overall body.
What's the connection between a primary care physician and a gerontologist or geriatric specialist?
The primary care physician can refer a patient to us to maybe look at their medications, look at frailty factors, which we can address and send them back to their primary care physicians.
So tell us a little bit about your interest in memory care as it relates to geriatrics.
So the problems with memory have become increasingly more prevalent. It is a problem that tends to, we describe it as families have a very long funeral because the patients live long, but they have a disease. And if there's anything you can do to help this population and their caregivers, is something that excites me to be involved in.
At which point, or is it just general memory loss that you're brought in normally to connect with the patient?
Memory loss becomes significant to us when it begins to impact the person's activities of living, when it begins to make a difference in the person's life. At that point, we will now make a diagnosis of dementia.
Nice.
Now, there are different types of dementia. The Alzheimer's dementia is the most common of them.
When you are determining the reason for memory loss, doing the diagnostics, I'm guessing there's a component of that around medications and the use of medications. You mentioned you may do a medication assessment. Talk a little bit about the role of medication in discovering maybe origins of memory loss or even addressing it.
Medications tend to play a role more in contributing to memory loss. There are some medications that can alter the person's ability to function by making the person forget. So when we look at medication review, we are looking to see if such medications are on the patient's list, taking as many as we can off, and the ones that we cannot take off the list, we look for safer alternatives.
Tell us a little bit about the diagnostics, either testing or medical testing, that you might do when a patient is first referred to you.
Basically, we, like everything in medicine, we take a history. In this situation, there's a lot of emphasis on the history given by family members. Because the patient may not be aware, fully aware of the impairment that he or she is manifesting. We also, like we mentioned earlier, look at the medication list to make sure there is not one making things worse. Then we do some basic lab tests, looking for simple things that can still impact memory. Things like uncontrolled blood sugars, can still impact. Uncontrolled blood pressures, we make sure those things are well treated by the primary care physician. But more specifically, we're looking at thyroid function. We're looking at B12 levels, because low levels can also present as memory impairment. The other specific testing we do will be an MRI of the brain. And
so when a patient and a family come to you and they are coming to the memory clinic, do you find they are at a point where the patient believes that they can still feel that their ability is decreasing and they're aware of it, or is it more where, as you mentioned, a family brings in a patient and the patient is at that point unaware of how much memory loss they have? At what point should they be coming to the memory clinic?
What we are trying to educate the public is when you go to your primary care physician, as part of your annual wellness exam, which Medicare requires, they ask 2 or 3 questions about memory. And if the person didn't do well on those screening questions, we suggest primary care physician refer to us. We do 2 visits, one for evaluation with other appropriate testing, and then the second visit we wrap it up with whatever diagnosis we think it is, make recommendations for treatment, and send back to the primary care physician.
I see. So the screening is coming from the failure of the screening test.
Yes.
Now, we talked about this being a component of geriatrics, but can there also be younger than 65 patients who fail these tests, either with early onset Alzheimer's or even acute injury or chronic disease like uncontrolled blood sugar, and they fail the test?
Definitely, definitely. There are younger persons too. So in those ones, most of the time, you pick it up with a family member's concern. They come to the memory clinic at any stage, and in most situations, the patient with a memory problem is not quite aware of the extent of problem that he has.
So better assessed by the people around them. Do you find your role in diagnosis is stabilizing the patient or attempting to stabilize where they are in their, decreasing memory function, or is it trying to improve memory? Because we see a lot in the environment around improving our memories, but from a memory care clinic standpoint, it's the diagnosis and maybe stopping the memory loss from getting worse, either through medical treatment, or what's the role of the provider there once you've done the assessment?
So the goal is make a proper diagnosis and then initiate treatments. Right now, the treatments we have available are treatments that help to reduce the rate of progression of the disease. Some people think the medications can bring back some memory loss. Those have not been replicated in all the studies. What is definite is the fact that it tends to reduce the rate of decline. We are, however, looking at 2-3 products that may be FDA approved soon. They're in their phase 3 trials that seem to give a hope of halting the disease if it is picked up early and the treatment started at that early stage. For those that we pick up now and in the latter stages, we do a lot of education about the disease process and what caregivers should expect. We tend to link them to support services like the Alzheimer's Association. The Area Agency on Aging also helps a lot with directing them to appropriate care, appropriate help that they can use at home. And we kind of work with all these organizations.
Do you find that most of the diagnoses you are making are general dementia, or do you find that they are Alzheimer or Alzheimer-related diseases, whereas I think people have a fear of the idea of Alzheimer's, although it is a form of dementia. Where on the continuum do you see referrals? Do you find they're varied, or by the time they're referred to you and they have failed these screening questions, they tend to be more advanced?
By the time they fail the screening questions, they may not be advanced. But most people tend to present after caregivers had noted problem for several years.
I see.
So they are in the more advanced stages. Yes, as in all other studies, we tend to see more of the Alzheimer's dementia. But living in an area with what we call very high cardiovascular risk factors, diabetes, smoking, hypertension, we also tend to see quite a few vascular dementias that come from these problems not being properly taken care of in the younger years.
What do you see in your practice, both as a family medicine physician and in your specialty, that people can do to prevent dementia or early onset dementia? I'm sure there's a genetic component, but disregarding a predisposition, you talk about vascular dementia. What are some of the ways that people can protect their brain from dementia and maybe early memory loss?
Yes. That's interesting to talk about, because we keep sounding the same bell or the same song over and over. Exercise, physical exercise is good for the high blood pressure, is good for the diabetes, is good for the brain too. That is one thing that has been shown more consistently as keeping the function up, keeping the person function better for a longer period, so that even if the person will develop the dementia, it will be delayed. So physical exercise, very important. The other factors will be controlling the risk factors, treating your hypertension, your diabetes, your cholesterol, stopping smoking, managing those risk factors very well when you're younger, so it reduces effects on your arteries and the brain when you get older. Keep your brain challenged. If you like reading books, keep reading. You like puzzles, crossword puzzles, word search, just something to challenge your brain other than just sit in front of a TV set.
Right. So a final question for you. How do you feel COVID, in light of the isolation that some of these patients might have experienced, as well as maybe not going to their PCPs and going through this checklist? And do you think you're going to see this tsunami of, much like other primary care, where it will be an untreated and exacerbated area of disease with the isolation of some of these patients who might have otherwise, kept active, stayed social, and went to their primary care providers? Any thoughts on what you're seeing now as patients start to come back?
Yes. One thing we see is families may have noticed some symptoms early last year and refused to bring them in till now. We've also seen where they didn't know any problem existed, but the staying at home has made them interact with the parent more and made them observe. The other thing will be that even those who have the diagnosis tend to have more behavior problems because of this staying at home situation. They have more challenges maintaining their normal behavior, if you want to put it that way. So yes, there's an increase in new diagnosis, an increase in acute worsening of previously known diagnosis of dementia.
So if a patient, well, a future patient or a family might be watching us when we show this video, what's the way that they get in touch with you or the Georgia Memory Net, or how's the best way to connect? Or maybe through their primary care provider. What's your best?
The best way is through the primary care provider. If you've noticed a problem with your family member, let your primary care provider know, and you can refer to us. If you've not noticed and the primary care provider is able to pick it up through the screening questions during the Medicare annual wellness visit, then they can also refer to us. We just do 2 visits and then we send you back to your primary care physician.
Well, thank you for telling me so much about the Memory Care Clinic.
It's my pleasure.
And thank you for joining us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. Baralatei's practice or about her family medicine practice here in Central Georgia, please visit us at atriumhealthnavicent.org.